Okay.
Good afternoon, everyone. We are now back for our first session of the day. Our first session begins with a talk by Professor Karana Tilake. He is a professor of sociology at the University of Kelaniya in Sri Lanka. Professor Karana Tilake has more than 30 years of experience in university level teaching. His main areas of expertise are social impact and environmental assessment, social safeguards training and capacity building, and resettlement planning and community mobilization. He has been an international consultant on safeguards and has worked for the Asian Development Bank and World Bank on several projects in South Asia. Professor Karunatilake has played a pioneering role in developing courses on involuntary resettlement, social impact assessment, capacity building, and project monitoring and evaluation. He has prepared a manual on social and environmental safeguards, which is now being widely used by infrastructure projects in Sri Lanka. Dr. Karuna Tilake has published books and papers on social and development issues in South Asia. Welcome, Professor Karuna Tilake. Ayubovan. Over to you, sir.
Yeah, thank you very much, Vandana. I think that no argument that we have gone through very descriptive conceptual framework given by Professor Maitri Chowdhury. It is very interesting. But in my case, of course, I am trying to share that Sri Lankan experience in this pandemic situation. Basically, the purpose of this presentation to share the Sri Lanka experience of COVID-19 control mechanism and experience from the date of the first reported case in 27th of January to analyze the Sri Lanka experience in sociological perspective, mainly through functionalist perspective. So I think that Sri Lanka is now in a very controlled level of this pandemic situation. However, now we have been past a lot of critical stage during the curfew or lockdown situation. So therefore, that many experience that we experience is very important to share with this South Asian regional countries and experts who are participating in this discussion. So basically that we know that it is not merely a health problem, it is a social problem, as Professor Chowdhury explained very well. And then there is a particular role to be played for social scientists, and even that we hope that frontline decision makers should consult, engage, and share social scientists' views and their experience at large extent. So this webinar even that I think that make a platform to share our experience and even they do a lot of analytical part and even the comparison. So therefore, I think that it has a particular use in academics and even planning purpose. Basically, that let's draw our attention to background of the disease in Sri Lanka. Uh, this basically we believe that emerged in China and even that currently in the worldwide there are over 5 million affected persons and even 325,000 deaths. And even when we focus to the South Asian region, then there are 191,000 infected persons, which is representing 3.8 with the world reported cases. In India, having the highest infected persons in South Asia, which is 107,000, which is 56.4 percentage by last evening. The Sri Lanka is having 1,027 infected persons identified so far, and when compared, it is the second lowest in South Asia. However, that the health official verified yesterday that for 20 days there is no reported case at the social level. Only cases are reporting from quarantine centers and from foreign migrants. Basically, if you look at that chronological history of COVID-19 in Sri Lanka, the first case reported, as I mentioned earlier, in January 27th, and then the patient was the Chinese national who came to Sri Lanka as a tourist. And then the first Sri Lankan national identified in 11th March, and then there onwards daily identification of patients has been gradually increased until 5th April, and then the report number of cases has been reduced up to 1 case per day in 9th April. However, the trend was changed again as the second wave of COVID-19 and highly identified cases up to 65 by 27th April. And then identification of COVID-19 is in a volatile situation by today. Basically, we experience over 1,000 cases and even 9 deaths, which is low number, but however, it occurred in Sri Lanka as well. And then next, if we continue the presentation, that just to control the situation, the president of Sri Lanka, he appointed a particular National Operations Center for Prevention of COVID-19 outbreak on 17th March. So this center is coordinating preventive and management measures to ensure that healthcare and other services are well geared to serve in general public. And the national center, which is managed by Sri Lanka Army, initiated many activities related to infected patients, suspicious persons, and quarantine persons have been identified in different clusters. In addition, there are a lot of responsible, accountable institution, including the Ministry of Health and Indigenous Medicine, Health Promotion Bureau, which is actually giving an excellent guidance for all people how to control and even that addressing some uh, social stigma cases and even research level. Next, we can focus to the trends of spreading COVID-19 in Sri Lanka by starting from March 11th, so that you can see that how there are very clear two waves can be identified. So in March as well as in April, and then again now it is another wave, but it is mainly from quarantine centers. Basically, that operation center that I did, where when they report any case, that all people have been identified and even lodged in a operation quarantine center. So the next slide also showing that how that categorically identified people. Basically, there are two categories that symptoms can be easily identified, and even symptoms are not appearing in general way, and then only that PCR test and the other test are essential to identify patients. So now, in Sri Lankan case, that one naval camp highly who have been involved in this tracing cases in Colombo and other districts, then they have been affected, and then a lot of young people, young soldiers affected. That's why that we experience the second wave in April, and then most of them are actually not showing that general symptoms of COVID-19, but actually they only through PCR can be identified that they have been affected. And then next, we can see that how the government is manage this particular situation when that the entire society is closed down and even that curfew imposed. And then people, of course, especially that vulnerable families or groups, then they have been faced a lot of issues to maintain their livelihood. So then the government decided to actually give them a particular financial grant per particular person. Perhaps that basically the person been paid 5,000 rupees through Sri Lankan rupees. And then basically some families may be having two, three eligible or entitled persons may be getting a substantial amount at family level. But however, this financial grants disbursed by the government administrators, or even the grassroots level government service mean actually help them to cope up with the disease, and even during the curfew time. And the next slide basically it shows that how one particular division disperse these particular financial grant. Basically, where in this particular rural area division, there are about 188,000 people, and then so for 45,886 families, and then that in a smallest division administrative services are for 42, and then other all statistics are how they disperse these financial grants to each families and then particular persons. So it shows that actually a substantial number of families in urban or rural or state sector, they have been uh, taken and even granted these provisions, and even that help a lot for their livelihood purposes. And then if you look at that next slide, that you can see that how people are satisfied with the government that COVID-19 control management. This study was done by one independent survey institution, and then they have conducted 2 rounds of the survey in early, latter part of the March and the mid of April. And then you can see that satisfactory level is very high with the government management of this COVID-19. And then next that I would like to focus on that uh, how this pandemic situation actually influenced to the Sri Lankan social structure. Basically, there is no doubt that social structure has been drastically changed, and then social relationships and psychological conditions of people in Sri Lanka is highly affected. And especially these impacts would have direct link with economic, socio-cultural, political, educational, health and technology spheres in the country. As Professor Chaudhary explained that this pandemic situation is influenced in every aspect of social life, in even social structure. COVID-19 has made several impacts over the social structure. It may display some changes in the social system. These changes may be upgrade and uplift the social system in the line of adaptation. It seems that people in Sri Lanka basically adapted to the situation, pandemic situation, and even that they extended the maximum support to the government to control the situation. That's why actually today that we are having some sort of positive or green lights in terms of the control in the virus. These impacts can be divided into two major categories, namely negative and positive impacts. Basically, we all are sociologists. Actually, we know that that how this functionalist perspective can be utilized for the social analysis, and then using that, that I would like to first present that what are the positive impacts that we can see in our society. All production, distribution, market, and banking systems are being obstructed, and several modern market and distribution network failed to address during the curfew period. However, the new market strategies emerged, and certain degraded market system received a high demand in each cluster or locality. Basically, that all these traders actually taken the curfew passes and the government passes, and then with the support of the health experts and the local administration, then they circulated all fundamental goods and services, and then people utilize or adapted to this situation. The people are adapting to the pandemic situation, and they also understand what the ideal social behavior is in a similar situation. Actually, earlier there were no much experience, I think, in Sri Lankan context. Mid of 20th century that we experienced the malaria pandemic situation, that after that actually we don't face any such cases, but as a virus that we know that when malaria dengue is very critical on the other way, and but it is not like this. We know that how it actually transmit. So therefore, that but this case is highly critical. And then now people learn how to live in a pandemic situation. They learned about social distancing and its rules and procedures, and especially that how painful it is, but useful may within the family and the community. So also they adapt themselves to the situation while contemplating on the difference between normal situation and pandemic situation. And as a result of social integration, families and communities engage in high level of social cohesion or social conscience to face the complex situation. Hence, everyone is getting used to common lifestyle, sharing and caring of others, especially the elderly people. Basically, that Sri Lanka, the majority of them are Buddhists, and then they have a lot of the dana concept, and even this philanthropic background help people to actually adjust to the situation, and then they care each other and share, and even that all poor people, in addition to the government support system, that people exchange their uh, goods and services. And the death of an elderly or of chronically ill persons results in reorganization or reunion of the family unit. But actually, in our case, there are 9 deaths. Actually, but however, except that Islamic families, that others people that especially that they adjust to the situation, but with the government decisions to burn the death body, there were certain allegation from the Islamic community. However, the next slide. The biomedical system will be improved to sustainable levels of, to face a pandemic situation. They will understand the existing gaps in the system, which is also a positive trend. And then especially people are keen on their indigenous medical system and how it should be integrated with the biomedical system, which is having poor results integration now. However, their dominant health authority may be challenged by the indigenous medical practitioners due to the strength of the indigenous medical systems to treat COVID-19 patients. Now, there are a lot of integration and discussion going with the biomedical experts that how to integrate this indigenous medical system treatments. So next, there are many discoveries and innovation in all affected sectors at national, regional, and global context. That most of these are in medical, environment, industry, and socio-cultural related. Basically, that country-wise, there are a lot of such discoveries and innovations. Now, government is planning to give them priority and then some sort of financial assistance to introduce many equipments which is directly related to the COVID-19. There are potentials of adapting in domestic production and services to maintain local lifestyle rather than adapting to modernity. The people may repose their trust on many local trade and business firms rather than depending on the supermarket system. That domestic production could increase due to the family or cottage level agricultural practices, including other small scale handicraft production in the society. Because now people got substantially a lengthy holidays due to the curfew and lockdown situation, and they started their former lifestyle, which is mainly covered with the agricultural practices. Next slide. The pandemic situation may increase the level of innovation among the people. Some creative minded people may introduce much effective and productive primary and secondary things, efficient ways and means of production, low cost production, technological advancement, etc. The people are uh, attracting to traditional foods and consumption practices mainly based on the human family. Intergenerational social integrity will strengthen be consolidated by youth. Basically, we had that very modern life. Perhaps in urban areas, people totally depended on that fast food services and restaurants and everything. Now, it has been completely changed as a result of the pandemic situation. The new ideological construction will be occurred in many critical subject disciplines such as medicine, economics, political science, sociology, psychology, robotic science, religious and humanistic sciences, because of the rethinking. And also the people are getting used to do some optional analysis and adapt to the follow optimal use of resources, economizing resources, and sustainable approaches to satisfy their need structure, because that we don't know when it will over, and then perhaps that influence people to actually think in this light. General public may develop some positive attitudes over the special duties performed by various essential services in society, especially health workers, social workers, police, armed forces, who are involved in quarantine processes, etc., that having very positive attitudes because of that their excellent service. So reduction in plastic and polythene use at domestic level, thus reducing environmental pollution. As a whole, it may contribute to low global environment protection efforts. So maybe there are temporary things, but of course that we experience, we can actually utilize this experience for rethinking about that our social change in process. And then reduction in environment pollution in the world, regional and national context, mainly that air, sound, water pollution will be reduced. There are some studies conducted and revealed that population level is reduced drastically in all these three sectors. Next slide. Possible formation for further philanthropic ideas among the upper hierarchy segments in society. As I explained earlier, that this is gradually happening. If the government is successful in managing the COVID-19 instead of developing a pandemic situation, it can lead to a stable political order in the society. Perhaps the incumbent government could win another term in power, as the pandemic situation has provided a great opportunity to compare each country and its skills of governance of their political regimes. So I think that this is a very critical factor to think, and maybe now we are having this parliamentary election, and it's already postponed due to the pandemic situation, and there are a lot of arguments going on how to conduct the situation, and then election commissioner that argue that he need that health experts certification. So now there are some court cases related to the election postponing and etc. So I think that this will give some positive results very soon. And reduction in crimes such as drug addiction, alcoholism, gambling, prostitution, or commercial sex, violence, suicide related to the conventions reasons. So therefore, that certain aspects of that crimes have been reduced, but in maybe on the other way, social due to stress, the domestic violence, etc. These are the things on the other way that having some trends. Sri Lanka needs a policy on indigenous medicine, which is not covered by the existing health policy in Sri Lanka. It is the right time to respond to the court decision and request for a new pharmacopoeia with a list of codes. So now with the integration of the biomedical experts, now these things will take place soon because of the people's demand. More utilization of the internet for sharing ideas, new knowledge, filtering knowledge gaps, news message, etc. There is a very visible things, and this may open up more avenues to reduce stress level of the people. Perhaps now this webinar is a part of this. The next, the return migrant who are having strong financial resources may invest in Sri Lanka if the socio-economic and political stability is established after the complete control and management of the pandemic situation. And the next slide, please. Returning migrants with less or poor financial resources may seek jobs in apparel sector or plantation sector. So therefore, there will be a high supply in the labor market in Sri Lanka. So currently, that there is a problem in our labor market, but perhaps that it may change. So finally, that there will be more research on COVID-19 impacts related to economic, socio-cultural, political, educational, technological, trade and market system, psychosocial, and health spheres. Of course, these are some positive aspects that we can now think about what are the negative impacts the country has to undergo in global pandemic situation due to COVID-19, and there is a fear of disease and chronic illness. High rate of deaths due to various illness or complication of disease occurring among the patients, especially the elderly who are affected by the COVID-19. So though the cases are very low, but that trend is there. Dismantling the usual family relationship and intimate relationship with relatives, neighbors, various communities, etc. So these conditions may lead to interpersonal conflicts and domestic violence in the family. Perhaps now people are highly migrated, internally migrated, and they don't have enough space to actually maintain the very high level, the physical physically relationships with them. Losing the knowledge, experience, and service of elderly would mean that the next generation would not be able to share them post retirement. Next, the downward trends of family economic condition and several lower hierarchy social classes facing unbearable economic hardship due to lack of daily or monthly earning. So basically, that lower strata is the very highly affected community, and then they are in a very critical situation. And the next slide, the disruption in schools, universities, and vocational education segments, and they have to seek certain optional strategies to cover up their educational goals. Especially, they might face some irreversible gaps in their education. Currently, the school educational system has introduced that E-based education, and but problem is that peripheral areas and even that poor social segments, they don't have access for this. So then it's a problem. And then some people may face various kinds of stress, social stigma, and depression conditions due to malfunction of the social system, and even that poor functioning of social relationships. And then possible social conflicts or conflict of interest in subsystems, and this may lead toward the social system. Some institution and organization may not possess sufficient capacity to find remedial solutions to fill the gaps and issues. So I think this kind of social interest, or I mean conflict of interest, maybe change the social structure covertly or overtly. Decline in religious belief system and practices in all religion, and people may not believe in superstitious powers and God and other divine and invisible elements. This is actually highly discussed in social medias, so that people are now rethinking that what's the value of this kind of belief systems. If the government and its subordinate authorities face some inadequate and workable decision or binding decision and poor policy application, it may lead to a political instability in society. These conflicts of interest may cause political change in the society. So therefore, the government is trying their level best to actually keep the political stability by utilizing the administrators and the other all institutional which is directly relevant to the pandemic situation. Next slide. Social unrest, stress, and social stigma among the family members due to their detachment from family as a result of local and international migration. This may further aggravate through suspension of continental air transportation under the lockdown situation. The Sri Lanka already closed all international airports, and now currently, of course, the government launched some kind of evacuation programs, and that all South Asian countries covered so far, and even the Middle East and some Western countries and Southeast Asian countries. I think except Bangladesh and a few other Soviet Union, Russia and the other Soviet Union countries need to get these services. Other than other old countries that who are willing to come, they have already managed and brought here, and then gone through the quarantine procedures, and a lot of people now reintegrated with their family. And disruption in the production of primary and secondary items in the society, especially issues in production of primary items, may lead to a social unrest in the society. So therefore, the government is basically emphasizing for the agriculture without concerning all these, especially in the non-affected district. There are many people who are losing their jobs and income in the formal and informal sector in the society. Service providers' inability to continue day-to-day support of commodities and other services due to lack of profit margins. It may lead to a detachment from such entities or services, and some people may find alternative solutions. People might depend on rumors and other informal channels of information if there is chaotic condition in formation channels or the dissemination of information. So therefore, that all social medias and then government and the visual and printed media, certainly they have a lot of responsibility to maintain this integrity. Next slide, please. Certain social classes may display their egoistic ideologies at the time of the accumulating primary and essential goods and services. At the beginning of the pandemic situation, these social classes, of course, that they gathered and then restored many things, and that kind of the egoistic ideologies rejected by many other social segments. This may cause some negative attitudes among the other social classes by creating conflict of interest. That global economic recession and increase in poverty level in society. This may be uh, this may make some financial crisis. Basically, now in our country, that financial crisis is very high, and that there are a lot of other negotiations going on, that development donor agencies and then other elements, that how to actually regain the development process. The country has to take alternative action to maintain a stable economy. The developing countries and poor countries may get more loans and grants for their economics to survive. Thus, there will be more economic and political dependency in these countries. So this is one very critical negative point. The pandemic situation will directly influence the sustainable development goals defined to be achieved by 2030, since some countries may not allocate financial resources to meet the country's specific targets. Next slide. The Sri Lankans who have been employed in foreign countries may return home, and further foreign revenues may reduce. It is one of major revenue in Sri Lanka. And then finally, if the government is not actually think and then develop a good planning, and then this may be yeah, another issue of actually managing that such return migrants for the economic development of the country. Perhaps that some vulnerabilities in the formal sector may appear in the society. Next, what are the possible remedial actions? So as identified, there are several negative impacts that can be developed as bottlenecks in Sri Lankan society. And we pay more attention on overt and covered negative impacts. It will help to retract the country in development path. Especially, we need to take this COVID-19 experience as a development opportunity. I think, as Professor Chowdhury mentioned, that how we should actually learn and how we use this experience for the betterment of the society. It is a dilemma, but that we social scientists, we need to actually think in much critically and even analytically how to utilize this as a development opportunity. Therefore, it is mandatory to identify what are the remedial actions to be minimize all negative impacts of COVID-19 in Sri Lanka. these remedial actions can be transformed as an action plan, and it mainly focus on socio-economic, environment, and political spheres, and not on the medical and technical spheres or domains only. We speculate that there are 36 such activities identified. Of course, there. Next slide. uh, we don't have time to actually discuss in that level of a detailed action plan, but I uh, uh, now move into I identify what are the benefits of adhering to the particular action plan, that if we can actually develop minimize the negative impacts. So basically, in my analysis, that we shared with these different social scientists in Sri Lanka, and even that we basically presented this particular action plan to the government, and then we believe that this kind of benefits are there to identify the actual needy people of the government social safety network under the COVID-19 control mechanism, to avoid duplication and miscalculation of needy people under the government social safety network implement under the COVID-19 control mechanism. Third, to minimize all aspect of unnecessary biases in the distribution of financial grants given by the government. Fourth, to minimize unnecessary government expenditure through identification of actual needy people of financial grants and other assistance. Fifth, to initiate innovative and positive attitudes among the various groups and communities. This is very important aspect actually, that as social scientists or sociologists, actually we have duty to actually think about what sort of attitudes to be implanted as a result of this pandemic situation. To reduce the level of dependency syndrome that can be identified in the culture of poverty in Sri Lanka. Seventh, to consider and take this global pandemic situation as development opportunity, as I mentioned earlier. Next slide. To strengthen the informal sector related occupants in urban, rural, and state sector of Sri Lankan economy. This is very important aspect, because now they have been suppressed by the curfew or lockdown and lockdown situation. The ninth, to minimize the social vulnerabilities among the different clusters of poverty. And then 10th, the better utilization of allocated resources for needy people under the COVID-19 control mechanism. And then 11th, minimize unnecessary political criticism against the government from opposition political parties. 12th, strengthen the social integrity of Sri Lankan social system. 13th, minimize several psychosocial stress and tension conditions such as social stigmatic conditions, suicide, domestic violence, child abuses, land disputes, drug and alcohol addiction, sexual harassment and violence, grave crimes, anxiety, institutional discrimination, etc. Next. Uh, so, if I conclude that my presentation, it is assumed that most of the proposed actions are focused on short-term and mid-term actions. However, there are some significant actions identified under long-term actions, which are related to individual and group level attitudes. So that though I have not presented these action plans, all these identified action can be divided into three categories: short term, mid term, and the long term. So that when we categorically identified all these things, that we can integrate with the government institution, and then launch a sustainable control mechanism to regain the social and economic situation, and even that formulate in a new social setup. Especially if the authorities focus on this action plan, it will help protect the family, environment, and the nation. Therefore, we need to have an attitudinal change towards a more sustainable control pandemic situation in our country, so that we don't know what will happen now that COVID-19, which is the most influential factor that we are talking, but we know that there are some other diseases, viruses appearing, and then children are affecting maybe Kawasaki or some other viruses. So in that aspect, that we should not actually take this very simple, and that we have to think about what are the future repercussions of this pandemic situation. So when compared to several historic experiences in managing pandemic situation, this COVID-19 pandemic situation can be used as a development opportunity to enjoy much higher take off with a new set of attitudes in the process of development. So this is finally, actually, I conclude that this should be considered as a development opportunity with the support of that all social scientists in the nation. So thank you very much. So that I think if there are valid questions from the audience, so that I'm ready to actually give them a much short answer.
I am
Thank you very much,
continuing my
Vandana.
life only, and I will continue like this only. If you miss your chance in
Thank
between,
you,
that is
Professor
not my
Karuna
fault.
Tilaka. Thank you so much, Professor Karuna Tilaka, for this deep dive into Sri Lanka and Sri Lanka's experience of the COVID-19 and how the nation has been able to cope with the pandemic. I think the reason why Sri Lanka has been able to cope is because it has recognized the COVID not just as a health problem, but as a social problem. And the importance of multi-sectoral approaches is clearly beginning to emerge. What is also very clear is that institutions and organizations have to function together interdependently for the larger common good. And we need collective cooperation for the social systems to function. And Professor Karuna Tilaka's paper, I think, points us towards the need to once again rethink how we understand situations of crisis, how we understand the breakdown of the social order, and how this breakdown is an all-encompassing breakdown. We have also been told how COVID can have its positive as well as negative outcomes. And very interestingly, Professor Tilakaratna has pointed out to us how there is a very critical role to be played by indigenous medicine and traditional systems of thinking. And indeed, we are at the horns of a dilemma. We are dealing with vulnerability of human lives and of differential experiences of people. We cannot live in fear, but I think, as Professor Karuna Tilaka said, this is a time for development opportunities. We are now open for questions, and Professor Karuna Tilaka, we have a first question from Mr. Bridgemohan, and he is tying together how you have talked about the need for social integration in pandemic situations, and yet at the same time, we find how people are stigmatized. So how do we strike a balance between fear and anxiety and social cooperation?
Yeah, of course, uh, we strongly believe, and even that had influenced the government authorities to have such a integrity or in the system of that control in this pandemic situation. Of course, so far that we, as a sociologist, I am not fully satisfied with that integrity, but now government has already given some orders to the relevant ministries to actually get utilized social scientists in their control mechanism, and then that would be a new beginning of reintegration these social scientists in the planning, as well as that initiating some development activities. So it is now gradually happening. So that earlier situation before the pandemic situation, of course, that I am not satisfied, because that a politically dominated society. But with this kind of pandemic situation, that a particular gap has been develop. So then if that is our duty actually, perhaps whether they come and invite, or that we spontaneously go and actually touch the system, or that even that influence them. And that's what we have doing in Sri Lanka, so that we written so many times, and even we already emphasize when we meet in such policymakers, so that there is a room for social scientists and even the other scientists in different sectors. So they, which is very important, and then need to get their involvement and then expertise to control the situation. Now it is gradually happening, but actually not in a very highly satisfactory level. But on the other way, that psychosocial issues, of course, that particular ministries and then health and social services, they are having some hotline systems to report if there are certain things, and even if someone uh, having some uh, uh, social stagmatic conditions. Actually, there are some hotline already, even that using the IT facilities, so that they can get the service of trained counselor, and even they filtered this and even given to the next hierarchy, and those people are basically that dealing with the registered people, and then they delivered the service at their level base. So therefore, but as a sociologist, actually, when we look at that reported cases, not too much. So it means that the people may not actually face such very serious level of psychosocial issues, or perhaps they are not believing that services provided, or perhaps they don't know much how to approach these things. So therefore, that what we have done is that with the health promotion bureau, and even I am a part of that research, that we have been launch a study that how to recognize that psychosocial issues. So therefore, that some research are going on then to actually trace the real situation. But institutional level, there are some services already been introduced, and it actually those services were there, but now it is already again revitalized, and then it is happening now.
Thank you for that detailed explanation, Professor. There are multiple questions that we have coming in from scholars asking about the impact of the pandemic on social life, social order, cultural values. If you could briefly throw light on that. And participants, we will be able to take only one more question after that. And there are multiple questions on the impact on the agricultural sector and the informal sector. So if, Professor, you could throw light on both of these questions, and then we can end your session after that. Thank you.
Yeah, of course, this value of and cultural aspects, there are a lot of discussions going on, and some leading characters in Sri Lankan society, actually, they are using social media, so perhaps Facebook, and to share their views. Even as a sociologist, actually, I regularly share my views in social media, and even so in local language, and even that international language, so that we get a lot of responses, people, and then that even it shows that people are ready to actually change their attitudes, but of course, so the problem is that when we conclude those things, actually they are questioning that how politicians are actually changing, because during the pandemic situation, that politicians participation with the general public is very low. So, and even perhaps we don't know what happened to the politicians, except I mean the key political figures in Sri Lankan government, but others, of course, that they kept silent, so there no direct participation. And of course, that certain social organizations, so that they launch many activities, actually support poor segments. Perhaps that some professional organizations also that they launch some philanthropic activities. So therefore, such integrity is there that so